as physician moms, we know that the invisible load can be very challenging. And that mental checklist, as you mentioned, it never stops running in the background. The snacks, the school forms, call schedules, emails, portal messages. And as physicians moms, we're kind of expected to carry it seamlessly. And the scariest part is we're so high functioning that no one even knows how tired we really are. So, to just start us off, when you're in clinic diagnosing HS, adjusting biologics, what are those invisible tabs that are kind of running in the background of your mind, even as you're seeing patients?
Yeah, I mean, I was thinking about this, just in terms of our day to day, right? We're supposed to be on, right, when we're in clinic. And I do think that when I'm actually in a patient room and sort of listening to the patient story, I am 100% sort of zoned in and I'm like listening to the story, I'm thinking about management plans, et cetera. But it's kind of those in between patient room moments where, your brain is, if it were like an internet browser, you just do have these tabs that are open and probably very like realistically mimicking what my actual internet browser looks like with those school forms and like spring break camp. And a mom mentioned recently, like, what are your kids doing for summer? And I was like, did we not just have winter break? Like, am I behind for summer camp? And then the dental appointments, the doctor appointments, and then in terms of work, right? Like clinical trial things and patient care things. And I just feel like there's so many different things to sort of keep our eye on and make sure it doesn't slip through. I mean, inevitably, I think sometimes things just slip through, even critical things, and I feel like horrible about that. Like if, a school thing is coming up and I didn't block off my clinic, and now I feel like, am I the only parent who's not showing up? And
Not at
so
all.
I just feel like there's just a lot of things. And so sometimes I'm like, when patients are just back to back and I'm in the rooms and I'm not actually thinking about anything else, it's actually easier in a way.
Oh, I agree with you. Those lull moments in clinic where you have a chance to check your phone, check your email, that's actually worse because then I start to fall behind because I start to do all this other stuff. And I feel like our brains don't really clock out, they just context switch. We kind of go back and forth. And
Yeah. And I
so,
think, yeah.
no, go ahead.
Oh, I was just going to say, sometimes too, I feel like once you do context switch, it can take a little bit of activation energy to get back to the other context. I'm like, maybe if you just don't switch as much, you can be more efficient, but it's hard to not let the brain wander.
Well, and it's funny. I remember reading a study about how when women are going to sleep, they are actively planning the next day, going through all these different scenarios. And when men's brain goes to sleep, they are not processing all that stuff. They go to sleep. So they actually say men have a more well-rested sleep experience than women, especially women who are moms. And I don't know if that's just a biologic thing. There's a reasoning behind it. Because I can't tell you how many times I wake up thinking I heard my daughter cry, and my husband's like, "No, she's fine. Just go back to sleep." I'm like, "But why am I jumping and you're not jumping?"
And I'm like, that sounds wonderful to just put your head down on the pillow and just like go off. You're done. You're done for the night. I'm like always planning for the next day or like, what are the weekend plans? I feel like there's constant like planning and thinking ahead. Absolutely.
And to some degree, I think we have to force ourselves to shut off that part of our brain. Otherwise, it just keeps running, running, running
Mhm.
in the
Like
background.
a hamster wheel. Mhm.
Exactly, exactly. Now, of course, we kind of alluded to this earlier, but you're not just practicing medicine, you're running a household in parallel. And do you ever feel like you're never fully winning at either one of those roles?
I absolutely feel that way all the time. I feel like I'm not doing a good enough job at work. I'm not doing a good enough job at home. And I wish I could be better in both settings. I think at work, I'm perpetually behind on things like emails or things that I need to like get to. And then when I'm at home, where everyone says like make sure you're fully present with your kids because they're only young once, and the time just zips by. And then at home, I'm like, I don't want to be on my phone and then trying to catch up on those emails that I missed from work. But I find myself sometimes doing that and then feeling so bad when, a kiddo is like, Mom, no phone or something. I'm like, oh my goodness, it's such like a jarring moment when I'm like, why am I on my phone? You are my priority, right? Like I need to put my phone away. And so definitely constantly feeling like I'm underperforming on both counts.
Well, and it's funny when people tell you like you need to be present, you need to do this, they don't tell you the how. They just tell you you need to do it. And I think that's actually more overwhelming. So I will give you a how that I kind of do because
Yeah.
I've had the same struggle with as you have. And we may have talked about this already, but between 5 to 7 p.m., that is my daughter's time. I do not respond to text messages. I do not respond to emails. I sometimes even put my phone on do not disturb so that only critical people like my mom or my sister can actually get a hold of me. And that's kind of my way of giving her the space that she needs. It's not perfect. There's going to be days where there's a fire at work that we need to put out, but it's helped my sanity because I can kind of be there for her. And at the end of the night, when she's going to sleep, after she's asleep, then I can focus on the emails and whatnot. But then my sleep gets compromised because now I'm staying up late as a result.